Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Dusablon, your host for today's show. Through our monthly program, we bring you information about Franklin County Home Health Agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. On today's program, I have several guests from Franklin County Home Health Agency, all of whom are celebrating significant service milestones with the agency. So I'd like to introduce Janet McCarthy. And Janet, you are serving 25 years this year.
Hard to believe.
Yeah, well, wonderful. And then Jodie, you are at 20 years. Jodie Archambault has been with the agency for 20 years. And Sharon Patterson, you have been with the agency for 30 years. That's remarkable. That's wonderful. And then Sophia Greenia, you're also celebrating 20 years. Wonderful. So I've just introduced you all quickly, but I'd like to just take a moment for each of you to say your names again and what your role is at Franklin County Home Health Agency. Janet?
So I'm Janet McCarthy. I'm the Executive Director of Franklin County Home Health.
I'm Jodie Archambault, and I am the Liaison Nurse, and I do telemonitoring, and I do intake and referral.
I'm Sharon Patterson. I'm a staff nurse.
I'm Sophia Greenia. I'm LNA.
Wonderful. So Janet, what are we celebrating this month, and talk about the importance of that?
Well, this is a really special time of year. Each June we take a week out of the month to celebrate our staff and say thanks and try to show our best appreciation we can for the work that they do in this community. So one of the days we are acknowledging and celebrating our length of service and our milestones. And combined, our staff are celebrating over 437 years of service to the agency, ranging from 5 years to 30 years. So it's a really just a really nice time to take pause and reflect on the kindness, the caring, the professionalism, and the work and wonderful service that our staff provide to our community.
It's wonderful. How many staff members right now at the agency?
We have just a little over 200 staff members, and we have 25 people that are receiving their milestone pins this year.
Wonderful. That says a lot about the agency and the loyalty of our staff,
Sure
as well
does.
as what the agency does for our staff. So wonderful people to celebrate. Thank you all for your years of service. With all these years, Janet, the agency started in 1969. So throughout these years, we've seen a lot of changes, and I'm sure since we're celebrating from 20 to 30 years, you folks have had a lot of experiences with change at the agency. Do you want to talk a little bit about that, Sharon? You've been with us for 30
Sure.
years, so as a staff nurse the whole time?
Yes.
Yeah, wonderful.
I started off, actually, I answered an ad for continuous care nurses for hospice, which was doing, I believe, a pilot program at that point, and they were going to pay you to come to the in-service. So I said, why not? I went to that. I ended up signing up. I did continuous care hospice nurse for a month. Then there was an opening for per diem, fill in and one weekend a month, and I did that for 2.5 years, and then started working part-time.
That's wonderful, and that talks a lot about our agency's flexibility for staff. What kind of experience did you have as a nurse before home care?
I worked at a hospital, a med-surg floor, and then a surgical floor in Keene, New Hampshire for 9 months, I guess, when my husband finished school, and I worked at Northwest Medical Center for a little over a year, and I actually worked one summer in between at a pediatrician's office, and then stopped to have my family, and then was looking to come back to work after I'd finished doing a refresher course.
So talk about the differences in working in those kind of settings and then working in home care. What did you find?
Well, you got to know your patients really well being in home care. The other settings, they were very brief. You never got to know them well. Some patients I've had for a long time now, sometimes for years. So that's nice. You get to be in their home, on their turf, and help them there.
Wonderful. What about some of the changes at home health that you've seen in your 30 years? What are some of the most dramatic changes, and how has it impacted your work?
Well, our space and our technology. We started off, when I started, we were at North Main in a house. There was a north team and a south team, and you had like 4 or 5 desks in each room. Sometimes some of us shared telephones with the desk next to us. That was before voicemail, before we had beepers, before we had cell phones, before we had computers. The beginning of the day, you looked on your calendar to see whose name was written down. You went down in the file, you pulled the paper files, you wrote a list for the receptionist with their numbers of where you were going, and if she needed to get hold of you, she would start calling those numbers.
Mm-hmm. It's funny, we've gone so far with technology that we tend to forget that we really were at a point where it was just pencil and paper, yes, and even not leaving messages on phones.
You had to, yes, you had to write a note and leave it. There wasn't even voicemail. That was once we got to our current office that we were going to have voicemail. Oh my.
It's wonderful. And what about the technology in the services that you provide? How do you use technology in actual patient care?
Well, we have our computers now, which help a whole lot when we're on call, because before you had no information. Now you've got it all at your fingertips. You can page other patients, other people if you need them during the day. We have the telemonitoring that Jodie works with. You used to have to grab a scale and bring it to somebody's home if you wanted them weighed, and if you wanted it every day. Now we can do that, and blood pressures and oxygen. Oh, we didn't have oxygen saturation machines. I remember going to Holiday House and borrowing one, signing it out, going to use it on a patient, and then bringing it back before we had them too. So there's all sorts of, you have morphine pumps and antibiotic pumps, like glucose monitoring machines, all sorts of things that weren't available.
And now for direct
back in the dark
care.
ages.
That's great. Talk about, so you're a staff nurse. You mentioned you started with the hospice program a little bit. At Franklin County Home Health, our nurses do home care and hospice.
That's right.
Can you talk about what is it like to be a home care nurse? What does your typical day look like now? And also, if you would share with us what the difference is with being on hospice cases and being a hospice nurse.
Well, so far today I've been in 3 homes and done wound care for 3 different types of wound, 3 different types of procedures, and have just signed a home care patient onto hospice. So it's been a busy morning. The home care, the focus can be different than hospice. Hospice are for folks who are terminally ill, who are choosing to remain at home for the remainder of their days, and our focus changes to keeping them comfortable, keeping their symptoms controlled, and allowing them to be at home and assisting their family or friends in providing the care that allows them to be there.
Yeah, that's great work. Well, thank you for doing that. What kind of ways, Sharon, do you and your coworkers stay on top of what's new and education and things? Talk about.
Well, we have in-services, both at staff meetings or throughout the agency. We had an in-service yesterday on some of the big bag bugs infection around. We have weekly staff team meetings that we get up to date on patients with either special needs or that have special equipment. Nowadays you have wound vacs and all sorts of things that years ago you never had. So yeah, we get a lot
to learn.
Always something to learn, yes.
Good. I'll bring it over to Jodie for a minute, because you did mention telemonitoring, and Jodie, you can talk to us more about that, but talk about your role at the agency and also the changes you've seen and the changes you've actually experienced yourself in roles.
So I started here 20 years ago when I was working at what used to be Verdell Village. I didn't even know there was a home health agency until one day one of my patients had mentioned it, and I thought it would be interesting to actually get to go into people's homes and get to really know them personally and their families and their pets and all that. So I inquired whether there was any positions, and it was the same thing. I started as a continuous care hospice / high-tech nurse, and back then we were actually doing block periods of times taking care of high-tech patients. I was working 8 hours in somebody's home, and then I became a home care nurse, and I worked like Sharon did for a few years, and then I worked in long-term care for 10 years. Went back to home care, and now I am doing, I'm the liaison nurse, and I'm also doing the telemonitoring program, and I do intake and referral. So the telemonitoring program is a program where we have equipment that we can put into patients' homes that hook into their phone line, and it comes back to our computer back at the office, and we can monitor their blood pressure, their pulse, their weights, their oxygen level. A lot of the people that are on it are people that have congestive heart failure, people that have breathing issues, COPD, hypertension, high blood pressure, chronically ill patients that just need to be monitored more on a daily basis, because the nurses will go in once or twice a week and we can watch them daily. So if they're having breathing problems or their weight's rising, we can talk to the nurse and they can do a visit. We can call the doctor's offices. Sometimes this week I just had one where the nurse was not working that day. The client had been seen the day before, so I could use her notes and what was happening, and I was able to call the doctor's office, and he actually made medication changes just from the telephone call, and then the client's weight went down the next day.
Wow.
So it's preventing people from going into the hospital.
Yes. Yeah, you've got this continuum of care, and they're being more proactive themselves, learning more about what those signs
What
mean
to
to
look
them.
for,
And
yeah.
that's really a great story. That's great. And Jodie, just listening to you talk about what you've done at the agency and in your years of service there, it's something we hear a lot about. Folks start one way, they learn a lot of different things. There's a lot of growth and different experiences you've been able to have, and that brings a lot to your current position. So talk about what it means to be a liaison and who you work with and how folks come to home care.
So I work with, part of the job is working with community partners. I have gone out to physicians' offices and talked about our programs and talked about our telemonitoring program. Because I've worked in pretty much all of the departments, I'm able to give that information to the physicians' offices. I also do go to the hospital on a daily basis and see our patients that have been admitted to see how they're doing. I work with the nurses and the social workers over there to give them information about our patients so that we can do better discharge planning when they come home or if they need to go to rehab for a short period of time. I also see patients that are coming out of the hospital that have requested Franklin County Home Health as their partner, and I go and see them in their room and talk about our services and when the nurse would be coming out, when the therapist would be contacting them.
So it's good to know there's such personal service. If they have questions beforehand, they can work that out with you, and that's good. That's wonderful. Thank you, Jodie. Sophia, as an LNA, what have you experienced in your many years here for differences? But first, tell us what it means to be an LNA. What kind of work do you do?
Well, taking care of people and helping them in their home and their families, keeping them so they can feel, I don't know the word, independent, you know, and comfortable.
Yeah.
Those are the big things.
Yeah.
And I've experienced a lot of touching moments with a lot of good people, and it's amazing how spending time with different clients, you learn from patients themselves on things that they want.
Sure.
And so basically, my experience at home health has been a blessing. And it's amazing how many different levels of care and personalities that you get to meet, which you don't get to meet in hospital settings because it's kind of, or nursing homes, because it's not that same closeness.
And like you said, you're learning from the patients.
I am,
You're in their
and their
setting.
families, and yeah, because they have the right to say what they want, and it's things that I've learned for another client to help that person out, you know. So yeah, I've grown a lot.
Yeah.
for
Now,
those
LNAs,
reasons.
you have many clients that you see throughout the day, and you also work with all of the staff. Talk about how you collaborate with other staff members and positions.
Well, we always have great nurses to call whenever there's something going on, or management, and we have a great scheduler. So if a client needed a special time, we can call, collaborate, and make it work for them. And basically, if we do have an issue with a client, and we need to come up with a plan, we will meet a small group regarding that client and what could be best for their needs.
Yeah, very personalized service.
Very, and it's very nice.
That's wonderful.
Yeah.
That's great. Janet, talk with us about your 25 years here and as the leadership of all these many wonderful activities happening at the agency. What kind of changes have you seen? And
well, I should start by saying, just sitting here and listening to these wonderful people, I'll tell their wonderful stories about how proud I am to be working at Franklin County Home Health. I didn't intend to stay 25 years. I just came for a little short stint while my kids were in school and so that I could work in the community that I lived. And wow, it has changed. Every year is different. It's like a new job, but I still get my paycheck signed by the same place. So I feel very blessed, and it really has been wonderful. And I think about Jodie's comment that she didn't, 20 years ago, she didn't even know that there was a home health agency in our community. And I think through the years, our programs and services have grown. We've become very knowledgeable and skilled. We have an excellent reputation. And I think home health is now seen as part of the solution and truly is part of the spectrum of healthcare services, working really hard to help people stay out of costly hospitals and avoiding emergency departments and really trying to be healthier in the community. And we certainly, technology is coming, it's come, and it's here to stay, and it changes all the time. And yeah, when I first came to the agency, we didn't even have a fax machine. And the administrative assistant said, "What do you think we need here?" on my very first day, and I said, "I think you need a fax machine." And she went out at lunchtime and bought a fax machine, and I said, "Well, now to use the fax machine, you need a phone line." And so, it's just something very simple, and now, we have fancy fax machines in our office. We have more than one, and just all of that technology has been really, really significant. But I think the core of what we're known for and what makes our organization so special is the people. It's the people that work at our organization, it's the people we care for, and it's our community who supports us through, positive comments, contributions, donations, and it's just a really wonderful place. We have wonderful community partners that we work with, the hospital, mental health, health department, adult day. I don't want to leave anybody out, but they're all a very important part of the care that we provide to the people that we care for.
Well put. You also mentioned prevention too. Talk about some of the prevention, community wellness type of activities the agency is part of.
Yeah, well, one of the big ones is our Nurse-Family Partnership Program and Maternal Child Services. It's a relatively new program for us, but we're seeing some phenomenal outcomes, helping young families get off to the right start, getting some prevention, education, support, coaching, so that these new moms have healthy pregnancies, healthy deliveries, and raise healthy children. And I think in 20 years they're going to be our future home health employees, and it's pretty exciting to be part of that.
Wonderful. So we are celebrating service and employees. How do folks find out about jobs at Franklin County Home Health Agency?
Well, we have a great listing of jobs, available jobs on our website, which is fchha.org. You can call us. We'd be happy to talk with folks, and we really encourage people to think about employment at Franklin County Home Health. It's been a great place.
What would you say are your favorite aspects of working at Home Health? I think you've said a lot of it already, but
I think the big thing is, the people that work here at this agency. A lot of them have been here for many, many years, and you build relationships, and they're just like family. The clients, you build relationships with them, you get to know them personally, and the flexibility. Home Health has been a great place to work while raising a family. Same thing, my kids are now in college, but I'm still here.
Yeah. Good. It's allowed you a lot of time with your family.
Yes.
Wonderful.
And I should add that we've had some growth over the last year. We've started to grow again, and so have quite a number of new folks that bring with them some great ideas and freshness and teaching. It's been really nice that they're teaching folks that have been with us for a longer period of time some new things, and the folks that have been with us for a long time, we can share and value the experience and history that they have in providing community health care. So it's really very find time to be in home care.
Yeah, nice balance, like you said, of the folks who've had a lot of history and then a lot of new expertise and excitement coming in as well. That's wonderful. Sharon, you want to share some of your favorite aspects of being a home care nurse?
I echo a lot of what Jodie said. It's great that I work with great people in all sorts of roles, whether it's the LNA or the intake people or my managers or my co-workers. Have a great rehab staff. When I first started, rehab might have had one. And social workers, we just have all sorts of folks now. But I love working with the patients too and their families. And like today, just this elderly person didn't want to leave their home. They're very elderly, very ill, and they just wanted to stay home, and they live alone. And we've been able to pull together friends and family to make the commitment that they're going to provide the care with our assistance to keep that person home the rest of their days. And that's very satisfying to be able to honor somebody's last request, if you will. And even people who aren't on hospice that they don't want to be in a nursing home, they want to be home, or they don't want to be in the hospital, they want to be home. And a lot of families are willing to learn what it takes to take care of them. Some of the patients learn what it takes, so it's just satisfying making a difference in their lives.
Yeah, that's great. What a gift. And Sophia, you do a lot of that, helping them learn what to do at home and things. How about you? Some of your thoughts on home care?
Well, some of my thoughts are, again, I'm trying to think of good thoughts here. There's too many. There's a lot of them, really.
Yeah.
It's when you can make a husband and a wife. Like this morning, I was helping a client. He's a hospice, and his wife was extremely tired. They were up all night, and he had a really horrible day yesterday. And he had a better morning, and so I was able to do everything for him, from, getting his bedding all nice and pretty and pink, I told him, and getting him set up and comfortable, and having his wife come in, and it was just nice to see them connect and feel like you were part of that.
Yeah.
You helped them in that way, and that's just, it's rewarding.
Yeah.
And there's other clients that have other needs on different levels. And just to be able to take the time out where home health does allow you to do that with each client, which is wonderful. That's my big thing. And some people have a hard time speaking, so you can take the moment and make them feel like they're that special, because a lot of people are busy, especially caregivers that live with them. So when you can go in and help them with that, it kind of relieves the family or the friends of the person, and it also makes them feel like they have that extra person listening to them.
Yeah.
And it's, again, rewarding.
Yeah. Well, what I'm hearing is you do a lot of there's a lot of physical and medical care going on, but you're doing that extra, very touching people's lives, and it's a huge gift. And just listening to all of you, I mean, you're very easy to be with, and we have staff that are like that really put people at ease, and to go into someone's home is a big deal, to go into someone's own space. So it's nice that
them letting us in is an honor, and then them continuing to let us in is a bigger honor, because that's a big thing. That's, I think, the goal is to work as all, and to
takes good personalities.
Make them want us to come back again,
very nice.
because of the care.
Wonderful. Janet, again, like you said, it's really wonderful to hear these folks talk about this work that they do in our community. Before we wrap up and stuff, let us know some of the other things that are happening currently in home health care statewide and goals.
Well, across all of Vermont, there's tremendous efforts that are being made around healthcare reform efforts. Everybody, whether it's the doctor's offices, the nursing homes, the hospitals, the home health agencies, the hospices, are working to improve patients' experience with the healthcare system, improve their outcomes, and really deliver quality care. And I've been in healthcare for quite a number of years now, and there have been a lot of attempts at each of those different things. This is the first time that I think in my career I've seen them all come together and be working all in alignment and at the same time. So in our local community, we have regular meetings and activities with our local providers, the hospital, mental health, the primary care providers and home health to really work together, and that's very exciting. We've talked a lot about technology. That's a big part of healthcare these days, and but you know, at the heart of it, it's still people providing care to people, and we never want to lose sight of that at Franklin County Home Health.
Wonderful. In what ways can our community help us help care for people?
Well, we love it when people choose Franklin County Home Health when they have a need for home health services, or be on the alert, and you know, maybe they have a friend or a family member who's struggling at home with some healthcare issues that perhaps we can help. We certainly appreciate the memorial contributions and other donations that our agency receives from our community. We're have 30 days left to our annual appeal. We've exceeded our goal for this year, so we're very, very happy about that, and we truly, truly, truly appreciate the spirit of giving that our community has shown. It really helps with our success. So, you know, call us if you need help, and consider us as part of your giving plan.
I was going to ask Jodie to recap how you do receive a referral, or if you do see that your family may need help, or you think you do, or what situations lead you to coming through our doors. Or
So we get our referrals from several different agencies. A lot of times the doctor's offices that will refer to us after they've seen a patient in the office, or we get the referrals from the nursing homes or the hospital when they're coming home. But we also get calls from family members that are calling and they want to know about our services. So they can call us anytime. You know, they can ask for intake and referral, or they can specifically ask for me, Jodie Archambault, and I can talk to them about what services we have. And we have facilitated calling the physicians to get those orders for us to go out and see patients. We can do an evaluation to see if they meet the requirements for home health.
Good. So they can call us 527-7531.
Yes.
Wonderful. Well, thank you all for being here and sharing your experience. Congratulations on your years of service. You should be very proud, and we're happy to have you at Franklin County Home Health. Thank you all for watching, and if you have any questions about the services provided by Franklin County Home Health, again, you can call us anytime at 802-527-7531, or visit us online at www.fchha.org. We thank you for watching today, and be well.